CPHE on the public health side, from HCPF on the administration of course, federal dollars for Medicaid and other programs, our insurance commissioner, which in our state is an appointed position. So it's really around how do we bring everything together around producing real cost savings for people, which includes things like, of course, using Medicaid as one of the largest payers in the state as a driver of reform. It includes looking at how we implement the health insurance market, the exchange through the Department of Insurance. So these are all things that we look forward to working on the implementation of, as well as we're looking on legislative improvements.
What's the timeline for this? When will this office, formally be open and people will be able to access it?
It was created today. We're hopeful that the modest funding request will be forthcoming to allow it to gear up and do its important interagency work. I think that it'll produce great savings for Coloradans in conjunction with helping to implement and helping to work with the legislature on getting many of their ideas across the finish line.
Benefit from this? Where do they go?
Well, again, as of this creation, Diane Primavera is now the head of the Office of Saving People Money on Healthcare. So that's what we announced today. The office has been created, and Lieutenant Governor will be spending a fair amount of her time on this. In addition to her other duties as Lieutenant Governor, this will be one of the major areas that she is focused on starting today.
What's the cost on this?
What's that?
What is the
funding request? Let's see if we have the number here. Does anybody know? No, it's less. 227,000. 227,000? 247,000. Yes.
So you're going to address the issues of cost in healthcare and the drivers, and that's one thing this office is really going to be focusing on. What is the single biggest driver of healthcare costs in Colorado? Is it hospitals or is it insurance?
If it was any one thing, I think the solution would be a lot simpler. The fact is that there are costs that accrue our cost system, and we have to leave no stone unturned. Like take a look, for instance, at prescription drugs. Prescription drugs are somewhere upwards of 15, 20% of total healthcare costs, and Americans are paying 3, 5, 8 times as much as consumers in other countries. Of course, we also want to take a look at hospitals and providers. We want to make sure our insurance commissioner holds insurance companies accountable. We want to look at all of the drivers across the entire sector, including healthier behavior, diet, and nutrition to have healthier people. As the Lieutenant Governor has said, prevention is often the best way to promote health as well as a great cost savings.
Governor, I can't see everybody in the room, but I can't help but notice that I don't see many Republican lawmakers, if any. Does this mean any of you had conversations with Republican lawmakers that said we're not interested in saving people money on healthcare?
I hope that it's a bipartisan and nonpartisan issue. I think that whether people are independent or Republican or Democrat or Green or Libertarian, they're all being ripped off on healthcare costs. Many of the ideas that our legislators have introduced, that Representative Garnett talked about, that I talked about, we fully expect that many of those will be bipartisan.
Governor, part of what you said involved prescription drugs importing from Canada was a part of your first 100 days in office action plan. Do you believe you would need to obtain a waiver from the federal government in order for that to happen?
We're looking into the legal aspects. The waiver piece would likely exist within the Medicaid program. We are also looking at doing it in a larger scale on the private insurer side to save money. And we're working with legislators and within our executive authority to find all solutions to drive down costs on prescription drugs.
And we have time for 2 more questions.
Governor, can I get one more comment on the looming education crisis? With all due respect to why we're here today, can you talk to Denver families about what you plan to do?
Well, I would just say, no matter what you do in our state, whether you're a teacher, whether you're a federal worker, health care costs are high. And many of our public sector employees have the benefit of strong benefits programs, but they still have those same cost drivers. So if we can succeed in saving people money on health care, it applies to the public sector as well, counties, the state government, school teachers, and others. And the more that we can save on health care, the more there is for salaries and other priorities.
One more
Will you
question.
please look at mental health, please? Reevaluate it. Right now, I feel like it's a Band-Aid, our local counties.
Mental health and behavioral health are absolutely part of the mandate of the Saving People Money on Healthcare office. When you look at how people can comply with treatment, how they succeed in their treatment, it's really important to view a patient and treat a patient holistically. All the data shows that in fact mental health can be a driver of costs and of bad outcomes when you don't have the prevention and ongoing access to treatment. I want to thank everybody for joining us today. We're looking forward to working hard. Lieutenant Governor Diane Primavera is looking forward to working hard, and we continue to work with our legislature and our administration to save people money on health care. Thank you.
Thank you.